Hey everyone, I'm Charlotte Marquis. I'm a board-certified veterinary anesthesiologist, and today I'm going to be talking to you all about autotransfusion. So, autotransfusion is the practice of giving a patient's blood back to themselves. So maybe they had a traumatic injury and they bled into either their chest or their abdomen, so a hemothorax or a hemoabdomen, or maybe they had some type of cancerous process which they bled into one part of their body. So autotransfusion is something that we can use to save a little bit of time, a little bit of money, and maybe improve patient outcomes. So this is something we do in our emergency clinic, but you can also do it at your hospital. So the practice of autotransfusion is, kind of like I've talked about, it's giving a blood transfusion to a patient using the patient's own blood. So this has a couple of different advantages that we can really kind of utilize in clinical practice. So decreased cost. So if you have a patient that already has blood somewhere, if you can give it back to them just in a different compartment, that's obviously going to save you quite a bit of money. This is especially helpful if you have a very large patient with a lot of effusion that might need many, many blood products in order to be stable. So if you had like a 20, 30, 40 kilo dog with a large heme abdomen, this is a fantastic option because you don't have to spend thousands of dollars on blood products. Start delivering it a little bit faster. So not only is this convenient in terms of the spread of your day, but in terms of patient intervention, this is really what you're going to want. Now, something that I will say about autotransfusion is that fluid therapy and blood product therapy is still delivering a treatment protocol. So you still need to do all of the same things that you would if you were selecting drugs for a patient, if you were selecting blood or fluid for a patient. If you are choosing to do autotransfusion, you do need to have a plan, you do need to monitor the effects of it, and you do need to be prepared for the potential benefits, but also risks that may accompany that choice that you need. Whenever I do autotransfusion, I always record in the patient's medical record the volume that I gave back, what type of technique I used, and what type of filtration or delivery methods that I used. In the event that a complication occurs, and especially if the patient is ill, you need a way to document this as part of your medical record, because the medical record is the way that we can provide a testament to our good care. Okay, so that's all the nice stuff, but what about the risks of giving a patient's blood back to them? No treatment protocol is free from any risks, okay? So this is certainly one of those situations. And what I will say specifically about autotransfusion is that, one, these patients are usually very sick. So I think it's important to keep in mind that the blood loss, is probably not the only illness that they have, right? The other thing to know is that currently the anesthesia, critical care, and ER community has some differing opinions about how to deliver these types of treatment protocols. So at the end of the day, it is going to come down to your choice about what is going to be best for the patient. It is still an ongoing area of research. Okay, so what are the risks? A coagulopathy in either direction. So giving an autotransfusion can either predispose the patient to having hypocoagulability, so a difficult time clotting and making blood clots, or an increased risk of clot formation. So anytime you have bleeding or hemorrhage, anytime you have turbulent kind of from the patient itself. So we know that blood, it carries and provides a lot of nutrients to the patient, and it's a great culture area for bacteria. So if you are transferring blood or anything, fluids, a drug, from one place to another, there is always going to be the risk of infection. This is especially true with open system autotransfusion, which I will cover in a couple more lectures kind of down the line. It takes time. Yeah, so that makes a lot of sense, right? If you have to find a spot to collect blood, collect the blood appropriately, and deliver it using certain filtration systems, delivery sets, it's just going to take some time in order for that to happen. This could either be a good thing or a bad thing. So, maybe that takes time away from your anesthesia monitoring record, or it takes time away from you helping the surgeons. At the end of the day, it just comes down to what's going to be important for the patient. Also, you can have electrolyte disorders with giving patients blood transfusions from themselves. So especially if you are using citrated anticoagulant, there is always going to be the risk of relative hypocalcemia. Again, monitoring and reassessment is going to be important no matter what. Okay, so I guess it comes down to the last part of this is how do I know when is a good time to autotransfuse the patient? Well, that's going to come down to the patient. They're going to make that choice for you, and you can also make that choice for yourselves. It's about what's going to be good for the patient and good for you guys in the clinic. So when do I do this? Like clinically on the floor, when do I think are the indications? If I think the patient is too unstable and they're just not going to be able to wait for either a transfusion later or even a little while down the road. So if they're very shocky, they can't stand up on their own, they're very pale, and they're having a lot of arrhythmias, I would definitely consider autotransfusion using one of a couple different methods. You have at least one person free. So you don't need 2 to 3 people to do this. One person can operate this entirely by themselves. Again, it's going to be faster if you have more than 2 people. But even if you are a sole operating surgeon or a sole operating person, you can absolutely save the blood and then transfer it into collection bags later. So that one person can be you, it can be your technician, that all works. You can see or feel the effusion. So generally, if you're going to be able to collect it and give it back to the patient, you probably want to be able to either blot it on the abdomen, like you know that it's there, or you can scan it on an ultrasound and at least find a fluid pocket. And then the method that you would pick to give that back to the patient is, of course, going to depend on how much there is and just what is your plan of treatment for that particular patient. Okay, so we've gone through some of the benefits and risks. We've gone through a couple of the decision-making things for autotransfusion. Now we get to talk about what are the options. So how can I deliver blood from one place to another, and what type of equipment do I need? And that I'll cover in a later lecture, but these are just a couple. So the first one I can think of is something called closed system autotransfusion. So closed system meaning that we haven't opened the body cavity, we've just entered into it. So an example of this would be I take an IV catheter and I attach tubing to a blood collection system and I aspirate it using a 3-way stopcock, and it never goes out fully. It just goes from like one place to another in a system of tubes. So closed system autotransfusion is one, and then I can think of open autotransfusion. So to me, this means I've opened the belly, I've opened maybe the thoracic cavity, and I am taking that blood using a suction system in the OR and putting that using syringes into a collection system. The two ways I usually do this are something called the two syringe technique. The other way I use this would be putting it into sterile suction buckets and then transferring it into blood collection bags. And for the next 3 lectures, I will focus on how exactly do we accomplish these methods.